Hi, this is Dr. Antolak from thegentlendentist.com in Shelby Township, Michigan. Phone number is 586-247-3500. One thing that's very important to know that when we do an oral examination, a complete comprehensive oral exam, we check the mouth for any signs of oral cancer. Oral cancer is one of the, I think, number 5 on the list of most common cancers, and it has one of the worst success rates because it's diagnosed at such a late stage. Our patients are happy to know that every single time they come in, either for a routine cleaning and then they get an examination done, or during their initial phase as a patient, I am very, very diligently observing through my loops and with gauze to look for any discrepancies and changes in the surface structure of the mouth. That is important so that we can then see if there is any potential problems of having any oral cancer. And when we do find something, which might be a red lesion or a white lesion, sometimes even very small, just some changes in the soft tissues, most of the time the most common area is underneath the tongue, but we can find it on the palate, in the throat area, anywhere, so that's why we're very diligent in finding out, doing a very thorough examination. If we do find that there is an issue and we're uncertain whether it's from trauma or from like a toothbrush or eating some hot food, what we'll do is something called a brush biopsy. A brush biopsy is, this is used as a sterilized brush, and it's cylindrical. You have to understand that a lot of these times these cancers have changes in the surface of the lesion itself. And so what we do is we use something called a brush like this. And what we do is we go in there and we actually scrape off some of the layers of soft tissue, and on those layers of soft tissue the cells start collecting right here on the brush. And then what we'll do is we will then take that and we'll take this slide and we'll take some solution and put on there, and we'll actually take this as a cytology screen, and we'll go ahead and rub it on there, and then this gets sent over to the laboratory. We use oral CDX as the name, and what oral CDX then does is looks underneath the microscope to see if there's any changes in the actual structure or any changes in the morphology and of the appearance of cells. And that actually does it through a computer program that they use. If there's something that they do recognize, they'll give us a call right away so we can let our patients know whether we need to take a deeper biopsy or if that patient has to be referred to an oral surgeon. So it's very important that we're full, that we cover everything, the full basis of it, and we follow the patient until we know for sure that there's nothing going on. Because oral cancer, once again, is the 5-year survival rate is quite low, actually less than many other different types of cancers because it is diagnosed so late. So if you are uncertain, if you have any types of strange looks, either your tongue or the roof of your mouth, or these swelling areas that you're certainly not certain of, then why don't you give us a call? We are located out in Shelby Township, Michigan, and our phone number is 586-247-3500. Thank you, and have a blessed day.